Good evening, everybody. This is Dr. Woeller, and I appreciate you joining me tonight for this presentation. This is going to be a little bit different. When I was putting this presentation together, I really sat down and thought, what am I going to talk about? Because, the title is quite broad. Troubleshooting various health complaints from body aches to chronic pain to everything in between, and poor sleep. And so I thought, I haven't done a question and answer type of webinar in quite some time. It's probably been a couple of years. And so I thought this would be a good opportunity to do so. Instead of me talking for an hour and a half on, just rolling through slides, I figured I'd open it up and let you ask your questions, and we can kind of dialogue back and forth. This is not a type of thing where anybody's going to hear your voice. So this is a, type the question in. I'll read the question, and then I will respond to it. If it's a question I don't know, I'll let you know. If it's something I do know about, I'll tell you about it and maybe expand on it. If it's something I may know a little bit about, well, I'll let you know that way too. I think you'll probably figure that out. So with that, I just wanted to give a little bit of a background. Let me just click on this here. And just kind of a little bit of a heads up on some of the things that I've been involved in. I know some of you have probably heard many of my webinars over the past number of years, and you can access a lot of those recordings from Great Plains Laboratory through their webinar library section. But I've been involved in parent and patient education, physician education for many, many years. And my main website, which is drwoeller.com, is a place that you can get more general information about me. It also has contact information for my practice, my phone number, my email. And I do a lot of in-person consults. I do a lot of phone and internet consults for people around the world, not just for parents with kids on the autism spectrum, but individuals with chronic fatigue or multiple sclerosis, rheumatoid arthritis, a variety of things. Although the vast majority of what I specialize in is biomedical intervention for autism. So you can access, if you're interested more as far as my consultation services, you can do that through the contact information here. Now, I have created a lot, I shouldn't say I really should say we, the people that I work with, have spent years creating a number of different websites, informational websites, to provide mostly information with respects to biomedical intervention for autism. One of those websites is autismactionplan.com, and this is a website that people can join on a monthly basis. It's a subscription website. There's no long-term contracts. It's just month to month. It's $37 a month, and you can have access to me on a daily basis if you want to post questions through a parent forum, and there's actually a section for private messaging. There's videos, there's articles, there's protocols, there's different places in this website that host information as well. The vast majority of people use it for the parent forum. So that is one avenue that you can reach out to me if you've got questions with respects to dietary intervention, or what lab test is useful, what does this behavior mean, etc. So that's been in existence for a number of years. I also have a number of books. This is one particular book, Autism: The Road to Recovery, at autismrecoverybook.com. These are ebooks, by the way. And this really goes through what I call the four-pillar approach to biomedical autism intervention, and really laying down the foundations of what I believe needs to happen in order to have progress with a child on the spectrum with respect to nutritional intervention, digestive treatment, yeast treatment, methylation support, etc. And then there's another book that I've had out, which is a therapy we may get into tonight if people ask the question, is Methyl B12. And we're on the second edition of this book. And this is a guidebook on how to implement methylcobalamin or methyl B12 therapy, including nasal spray and even dosing recommendations for oral methyl B12. The vast majority of this book is dedicated to the subcutaneous injections of methyl B12 in, what is it, what does it do, what can be expected from it, how to do it, where to access it, that sort of thing. I also recently wrote a book on methyl B12 for Alzheimer's disease and dementia. There's actually a lot of research about the usefulness of many of the same types of supplements that are used in biomedical autism intervention have a crossover effect and are useful for many individuals with Alzheimer's. And in fact, methylcobalamin, methylfolate, something called N-acetylcysteine, are all been heavily researched actually in the Alzheimer's world. And so this particular book is, again, it's kind of a guidebook on the implementation of methyl B12 and methylation therapy for Alzheimer's. I've worked over the past number of years with people with autoimmune disorders. And one of the groups, or I should say subgroups within that community of patients that I've seen some very good success with are individuals with rheumatoid arthritis. And there's a lot of interesting therapies that, from an integrative medicine standpoint, are quite useful for rheumatoid arthritis patients. Now, this could also be reactive arthritis or other types of inflammatory arthritic conditions. And so this particular book is about the implementation of dietary intervention, and it goes really pretty in-depth into how to implement something called low-dose naltrexone and also something called minocycline, which is a specific type of antibiotic that actually has some pretty tremendous positive benefits for people with rheumatoid. So if you know of anybody out there who's suffering with rheumatoid arthritis, they can learn more about some of these interventions at rheumatoidarthritis.com. And then just recently, we've launched a website called labtestsplus.com. And what this website is it's a public access website for the purchasing, self-purchasing, of various integrative medicine lab tests, many of them available through Great Plains Laboratory. So the organic acid test, the comprehensive digestive stool analysis, the hair analysis, the amino acid profiles. We also have access to lab testing for salivary hormones, whether that's adrenal hormones such as cortisol and DHEA, or sex hormones for estrogen, progesterone, testosterone. There's about 3 different labs that can be accessed, or 3 different labs testing that can be accessed through the site. The bulk of what we deal with, though, is Great Plains. And what's nice about this is that you can go to labtestplus.com, look to see what lab tests are available. And when you order them, when the results come back, you'll not only get the results, but you will also get a written interpretation of what the lab test markers indicate above and beyond what the lab provides. Now, some of the labs tests don't provide interpretation. The organic acid test from Great Plains Laboratory does, but in addition to that, you'll also get my take on what these lab markers mean and what they mean clinically. And then we provide what are called action steps, suggestions on supplement intervention or further testing, or what it may be. So it's a quite very useful service if you're having a hard time accessing some of these labs that we talk about through many of these webinars or conferences for more in-depth assessment with respects to health issues. So that's labtestplus.com. One of the other nice things about this site is you can also post some questions if you have a question or questions about specific labs. Let's say you've got a host of symptoms, but you're not quite sure what labs might be useful. You can go to labtestplus.com and go under the Which Test section, and then type your question there, and that'll come to me or my partner, and we'll answer it and give as best feedback as we can about which lab or labs may be useful for your particular situation. Okay, so with that, let's go ahead and open it up to some questions here And, once again, you may hear me pausing a little bit as I have to read through some of these things. If I read a question that I really don't know what the question is, I will let you know. And I may come back to a few questions if I didn't have time to read through some of them. So let me start here with a question on, and real quickly what's going to happen is more questions are added. Sometimes the previous question that I'm reading kind of gets kicked out of view, so just kind of bear with me here. What is my view on long-term Miralax? I try not to use it, but my child becomes constipated without it. It's a good question, and my preference is to not use it as well. Miralax, which is polyethylene glycol, it's got a number of other ingredients in it. It can be problematic for people who have oxalate issues. That's one of the downsides to it. I guess you could say the unfortunate reality is this stuff works really pretty well for cases of chronic constipation. I think there's a few things out there that can be tried. There's a product called Oxy Powder that tends to rival Miralax pretty well. You can go to oxypowder.com, and it's an oxygenated magnesium product. You'll have to just read through the website information. It's difficult to say how much to use in any person. It's not really dose based on age or weight per se. The other thing to look at with chronic constipation is what's causing the constipation. Is it a yeast problem? Is it a bacterial issue? Is there inflammation going on? Some kids who have chronic constipation are willfully holding the stool back. So they're actually, they're getting their urge to go, but they're not allowing their body to defecate. And if that's the case, then you really, unfortunately, you're dealing more with a behavioral issue. If it's a problem where they have the urge to go but they can't get it out, then sometimes that can be remedied even just with magnesium, like that Oxy Powder product, or using a fiber supplement. New Beginnings has a product called True Fiber, which works pretty well. Sometimes increasing probiotics, adding in aloe vera, sometimes these help with constipation. If it's a problem where your child just maybe doesn't sense that they have to go, that tends to be a little bit more complicated because it now gets more into the nervous system. There's a sensory problem. They're not sensing what's happening in the bowel. And there are, in some cases, we need to refer kids out to gastroenterologists who can do a further assessment, on that kind of situation. So I would say, Miralax is, try to avoid it long term. I have used it in cases where we might use it for, 7 to 10 days to try to evacuate the bowel, and then on the back end try to do more things like magnesium and aloe vera. But yeah, I think long-term use is not the best. The other problem that I have with the issue with constipation is, really the reality is when push comes to shove, I would rather have a child getting the poop out than having it left in their body. So, if you've tried everything, if you've done the magnesiums and the aloe veras and all of these kinds of things, and the only thing that works is the Miralax, well, to me it's not the end of the world. I'd rather use the Miralax long term than have a child who's chronically constipated because of the toxicity factors that come with that. So, with that, I think hopefully that helps you. Okay. Okay, some of these questions are really long. Okay, so I'm going to go here to another one. I'll try and skip around a bit. There's a question, is it possible that leucovorin and or methyl B12 could ramp up a child's self-stimulatory behavior, anxiety, echolalia? My daughter has MTHFR. She's nonstop stimming, screaming, flapping, also has probable Lyme treated with minocycline and doxycycline switching back and forth. Yeah, it is possible. One of the downsides to any of these types of methylating supplements is that they can increase enzyme activity, And that can, in some individuals, tend to overstimulate the nervous system and lead to some of the things that you're seeing. So things like the self-stimulatory behavior and the anxiety, could potentially be ramped up. I'd venture to, what I would say is the vast majority of cases that doesn't happen, but I do have some kids in my practice where the methyl B12 definitely causes some hyperactivity. And most of the time it's tempered by the folinic acid, which is what the leucovorin is. But I've had some kids definitely where they've got a bit anxious on it. The other thing here is that potentially what may be going on is that the methyl B12 is pushing a detox reaction. And so some other things to consider is, is your child toxic for other reasons? Is there heavy metal issues? Is there a lot of oxidative stress? The complicating factor here is the Lyme, and there's so many things that tend to switch on the immune system. What may be happening is the methyl B12 and leucovorin, because it has an effect on that folate system, that also has an effect on methylation. Basically, what it's doing is it's regulating T cell function, and you could have an increased immune response against chronic Lyme, and that may be triggering things as well. The other thing is sometimes the dose. Leucovorin is a pretty high dose folinic acid, so it may be a situation where it's not that the remedies necessarily are bad, it's just that they're being given in too high of amount. So, my experience with Lyme patients is that they're very sensitive to medications and supplements and to things in their environment. It may be that you just have to go at a much slower dose. Okay, paleo diet, low sugar, but kid has toenail fungus. What to look at first? Is this a common problem in people? It's not been my experience that toenail fungus is a common problem with kids on the spectrum. I think it crosses, a wide variety of patient populations. So I think there's some things to consider here. Is first and foremost, what are they wearing? Are they wearing shoes that either have been moist in the past? Is there some kind of potential fungal issue in the footwear that they're wearing? It also depends on where they live. Do they live in a very humid environment, or a wet environment where that could certainly be a problem? From a standpoint of what to look at with respects to fungus in general, the one test that I will always start with is the organic acid test from Great Plains. And the organic acid test is nice because it provides a measurement of toxins that are specifically related to Candida. It also will pick up on toxins related to mold. And then there's other markers on there too with respects to bacteria. I generally recommend doing the organic acid test if money is an issue, even before the comprehensive stool analysis, because many times you can initiate therapy or get a sense of a chronic yeast or bacterial issue off the organic acid test and initiate treatment, where in some cases the yeast doesn't always show up on a stool test. Now, there's some definitely usefulness for doing a stool test, looking for parasitic infections, looking for other bacterial infections. But oftentimes the comprehensive stool test comes back negative for yeast, where the organic acid test shows up positive. The other thing to consider in people who have persistent nail fungus, there may be some immune issues. You could do some immune deficiency testing, although I don't get a real strong sense that that's going to be a real big problem. I think the toenail fungus issue is not real common with the population of patients that we deal with. So is vitiligo and gray hair a sign of oxidative stress in a 13-year-old? Certainly vitiligo, being an autoimmune disorder, can be certainly traced back to oxidative stress in the body. The gray hair, most definitely too. Now you'd have to look at family dynamics and genetically, with respect to other family members to see if there's premature graying in the family population. But vitiligo, absolutely. Matter of fact, there's been some, good success with vitiligo in doing much of the same types of biomedical interventions that we do for kids on the spectrum or other patients, looking at gut function, looking at gut infections, looking at yeast and bacteria, looking at food reactions. Matter of fact, one of the tests to certainly look at with people with vitiligo or any kind of autoimmune disorder is the food IgG testing that Great Plains provides. Because if you can pick up on hidden stressors that are influencing the immune system negatively, then many times, in some cases you can turn that around. So I would certainly start to look at the core testing for any patient with vitiligo. Okay, so the question here is chronic thrush after mono 2 times in 1 year, stool test, immune deficiency test, or organic acid test. I would start with the organic acid test because that's going to give you more direct assessment of yeast toxicity than the stool test. The immune deficiency test, yeah, I mean that can happen with chronic mono, but first and foremost, I do the organic acid test. If you're not getting resolution with chronic problems from yeast through dietary modification and treating yeast, then yeah, you need to start looking at the immune system. But even if the immune system is deficient, you're still going to be treating for yeast. So I would start with the O, with the organic acid test. Have your test help with severe Tourette's disorder? I don't have a lot of personal experience with Tourette's. I know Dr. Shaw from Great Plains has had a number of individuals come through over the years from other doctors with Tourette's. He's done some lecturing about Tourette's. And the general consensus is yes. Can it be completely resolved? It's very individualized. There have been people who have had resolution of their Tourette's. There's others who've had significant improvement in their Tourette's by doing the biomedical testing. I think the first place, again, that I would start with somebody with Tourette's is looking at a food IgG test, the cross-reactivity of the immune system to certain foods. The reason the food IgG is important, particularly the one that Great Plains does, is it's looking at total IgG. It's not just looking at one individual IgG, it's looking at total IgG, which is much more important than, say, looking at just what's called IgG4, which is what some of the tests do. I would also do the organic acid test, again, looking for yeast problems, looking for bacterial issues and underlying metabolic problems. And I would absolutely look at a hair analysis to see if there is any excessive levels of heavy metals or deficiencies of minerals. There are some evidence out there that heavy metals can be at least an exacerbating factor with respects to Tourette's. Okay, so there's a couple good questions here. My son's test showed a slight yeast issue. He is phenol intolerant. What do I do to eradicate the yeast since most of the natural products are herbal? Great question, difficult situation. I run across this quite often. And, in these types of situations, the medications are often going to be more effective. Now, you've got to be careful because if you go, depending on how old your child is, if you go, let's say, get nystatin from Rite Aid, and if your child is really, really phenol sensitive, well, that nystatin over the counter is going to have some artificial flavoring and artificial coloring to it. This is where you'd have to go through a compounding pharmacy and get it pure. Now, you can actually get nystatin as a powder. That's not mixed in anything. It just comes as a powder. The problem is it's not the best tasting stuff in the world. That's why the pharmacies will try to put it in some type of oral suspension. So you can work with the compounding pharmacy to, to try to come up with a solution for something like nystatin. There's also things like diflucan, which are the systemic antifungals. Those typically shouldn't be used long-term because of the potential for liver stress, but nystatin is certainly effective. A couple other considerations for something like yeast with phenol sensitivity. There's a product called Candex. And Candex is actually a digestive enzyme that helps to break down the cell wall of Candida. So there should not be a phenol reaction. And Candex, can be taken once or twice a day. I've used in some cases 3 times a day. It's a little bit difficult to do in really young kids. It has to be taken on an empty stomach, ideally, because otherwise if you take Candex with food, it's just going to digest the food. But Candex is a nice option for that particular type of situation. All right, in what case would I choose hair analysis for saliva, blood, or other test? Another good question. I actually have an entire presentation on heavy metal testing. You can access that through the Great Plains webinar library. And what I do is I will, as an entry point, I don't know if you're a practitioner or if you're a parent or both, but let's say as an entry point for assessment, I will typically do a hair analysis, and if I can, I'll also do a porphyrin analysis. The porphyrin analysis is a urine test that Great Plains has, and it evaluates this metabolic pathway inside the cells of the body that is very susceptible to the presence of heavy metals. And so if that test is positive, it tells me that heavy metals are negatively influencing things at the cellular level and that the potential toxicity effect is much higher. The hair analysis is also a good entry point to just get an overall assessment. I typically don't do blood testing initially, only because 99% of the time the blood tests come back normal unless somebody had recent or has high ongoing exposure. The urine testing is not something that I will typically do up front unless I'm going to do some kind of a urine challenge, for heavy metal assessment where we're giving an agent to try to provoke the body to release heavy metals. So I think from a heavy metal standpoint, the hair analysis is a great place to go. If you're talking about hormone assessment, then or you're looking at cortisol, then my go-to test is the salivary, the functional adrenal stress profile, is looking at salivary levels of cortisol and DHEA, and you can also do salivary levels for hormones, progesterone, testosterone, estrogen, melatonin. And that's going to give you a much more functional picture of adrenal hormone output than a blood test, because the salivary tests look at the free fraction, which is the physiological active form of the hormone, versus just doing blood testing. Okay, so let's see. I have had the Great Plains food allergy testing done on my 4-year-old a few times, and he has shown allergy to dairy, peanut, oats, and coconut, and a few other minor foods. When we did the test last year, after eliminating these foods, he had many, many more foods. Is this a sign of another issue if the results change? Well, what it really kind of shows you is that the immune system is really heightened. It's like the volume is turned up. And I don't know if elevated means they were really elevated, and that can happen with a lot of us if you're eating the same type of food over and over and over again. What I would say in that particular situation is look to see if yeast is a chronic problem. There has been issues with respect to chronic yeast increasing or heightening the immune response in the digestive system and then causing a potential cross-reactivity with food proteins. So that's certainly a possibility in this particular situation. Being the fact that you've done it through Great Plains, we know that the test is looking at the total IgG, so it's more of a true immune response as opposed to just looking at the IgG4. The IgG4 tests are what they're really telling you is that the immune system is actually building up some type of a tolerance, so it's not that clinically useful. The question, should I do the IgG test if my child has leaky gut? Well, I would absolutely say yes, because leaky gut is a difficult thing to diagnose. It's not an all or none phenomena. It's a spectrum. And one of the things that could lead to leaky gut is a food reaction. So that in part, a high food reaction or a group of foods could actually lead to leaky gut. The question here is what to do about picky eaters. Is there something to do to help these kids? This is not my area of specialty, and what I would say is there's a really good article from Julie Matthews, and it was written together with a feeding pathologist. Her name was or is Don Winkleman. They wrote an article on this whole issue of picky eaters versus problem feeders. So you can try and go, Julie Matthews, well, the one website is nourishinghope.com. But if you just type in Julie Matthews, picky eaters, and then Don Winkleman, you should be able to find that article online, and that's very useful. So if it's a problem feeding situation, that tends to be a pathological issue that many times is beyond just sort of common biomedical intervention. That's where you have to really work with a professional that can help through one-on-one intervention to increase kids' capacity to eat. Okay, let me see here. Let me see if I can answer this. What would you look in patients who have suffered polypropylene mesh poisoning, suffering from severe oxidative stress, cytokine storm, severe inflammatory state, with a candida overgrowth, thyroid issues, and intense adrenal fatigue? What labs would you look at first to get a clearer picture? Organic acid or something else? I would first do the organic acid, and I would also do a functional adrenal stress profile looking at cortisol and DHEA. I would want to know how compromised the adrenals really are. If there's already a known thyroid problem, then that you may be able to pass on that. Those would be for, the organic acid test is a must. The functional adrenal stress profile is a must. And I would start there. I mean, there's a lot of layers, obviously, to that particular type of complexity, but those are the two tests that I would start with. Okay, the next question is, I was told we have heavy metals by a fellow practitioner, so expect them all to be positive. Any comments? I'm not sure I understand that question. I apologize on that one. Heavy metals by a fellow, so expect all of them to be positive. I'm not sure I understand that. I have not personally used cannabis, although the cannabinoid, oh, my mind is blanking now. I do know it can be quite helpful, where obviously you're trying to stay away from the high THC marijuana, but this is an area that is growing research, and I have had some patients in my practice who've done extremely well with cannabis as a therapy for self-injurious behavior, and I know there's a lot of kids getting some benefit who've got pretty severe seizure disorders from using it too. So I think it's a go. I think it's certainly a useful thing to consider. I have used a medication called Marinol. Now, Marinol is a synthetic cannabis medication that was more developed to help with appetite stimulation and to help with nausea in people undergoing cancer chemotherapy or AIDS, who are severely immune compromised. And it's tended to work pretty well. From what I understand, though, the true cannabis tinctures are much more effective. The next question is, do you have a lactulose mannitol type test for leaky gut, or what does GP offer for diagnosing leaky gut? Just to let you know, I don't work for Great Plains. I do the webinars. I use their labs, but I use other labs too. So I'm not an employee of Great Plains. Great Plains doesn't have, from what I know, these lactulose mannitol tests. I've personally not used those too much. I've been able to sort of access things, you know, in other ways, whether it's looking at food IgG testing, looking at organic acid testing, looking at stool testing if there's parasitic infections. There is a lab called BioHealth Laboratory that has a profile called the 304. The 304 profile is a salivary test that looks at immune reactivity to a group of bacteria, food proteins, and yeast by assessing secretory IgA and secretory IgM. That is a way of assessing for leaky gut. So the 304 test from BioHealth, you know, has some usefulness as well. You can actually go to labtestplus.com and go under the BioHealth section and look for the 304 panel. There should be a video and some information about it. Oh, okay, coming back here. So that question before is, you know, everybody has heavy metals, so therefore, you know, what can you expect? And the question is if everybody has heavy metals, then no matter whether we test for it or not all tests will come back all tests will come back positive. Well, yeah, I mean, that's true. We have all been exposed, but there's a big difference between being exposed in small amounts and being exposed in large amounts. And the other thing is, there is a big difference between being an individual who can be exposed to things in small amounts and get rid of heavy metals effectively because you have an efficient detox system, and being an individual who's getting the same exposure, but your detox system is poor and therefore your body accumulates it over time. So, I mean, this type of analogy to me is saying, well, you know, gee, all diabetics have high blood sugar, so there's no point in testing them for it. What the testing does is it helps you prioritize what heavy metal or a heavy group of heavy metals they've been exposed to, and how high they are. For example, and not all heavy metals carry the same level of toxicity either. So mercury has a different level of toxicity than arsenic versus lead versus nickel. So if you do a hair analysis on somebody and find their mercury levels really, really high, and you find their nickel levels not so high, and then you test somebody else and find their mercury levels not so high, but their nickel levels very high, do the two tests equate? Do both tests indicate a severe toxicity? My argument would be they show toxicity, but the person with a high mercury is going to be much more vulnerable to toxicity than the high nickel. Not to say that nickel at high levels is inert. So it's important to assess what the metals are. For example, I've done a lot of hair testing now with people all over the world, and I've gotten pretty good at, you know, getting a sense of where the hair test is coming from and what heavy metal is going to show up high. For example, the kids out of China, I can almost guarantee 98% of them have sky-high arsenic. Well, arsenic is found a lot in rice. They use it in chicken feed. It's found in herbicides and pesticides. I've seen the same types of elevations of arsenic from the kids who live in the Central Valley of California, where all the farming communities are. Kids out of the Middle East often tend to have very high levels of lead. They're not that high in arsenic. I've seen very high levels of mercury from kids out of China, in that part of the world. Makes sense because of all the coal mining. I've also seen high levels of mercury in people out of the Ohio Valley area, which is a very high, heavy coal area in the United States, and so you can pick up things that way. Lead tends to be smattered, but I find much higher levels of lead in kids overseas, China, Southeast Asia, Middle East, than I do here in the U.S. So the testing is important that way to tell you, give you an idea of what exactly you're being exposed to. The next question here is, do I recommend hyperbaric oxygen therapy? Yeah, I do. Matter of fact, I really like hyperbaric oxygen therapy for a wide variety of conditions. I've seen tremendous benefit for many kids on the autism spectrum. I'm not saying it's a treatment for autism, but there's a lot of documentation now that shows that there's a fair amount of kids out there who actually have a level of brain inflammation, and the hyperbaric is something that can help with that. There are other patient populations that do well with hyperbaric too. I mean, I've seen it helpful in chronic infections. There's some Lyme patients that undergo hyperbaric at times. Certainly anybody with a traumatic brain injury can benefit from hyperbaric. So, the discussion about hyperbarics is quite extensive, and I actually do have a recorded webinar on hyperbaric oxygen therapy through Great Plains Laboratory that you can watch. But yeah, it's a favorable therapy as far as I'm concerned. So the next question is in your experience, if you fix the gut's permeability, the IgG test should reaction also be fixed? Or will they keep reacting to the same food tested in the first place? Not always. Matter of fact, there was somebody who posted a question before where the different food reactions, because they changed the diet, showed up differently. So in fixing the gut, should you not have any reaction to food? In theory, yes. That should happen. And over time, those IgG reactions should diminish if the overall integrity of the digestive system is healed or improved. The difficulty is that in some cases that can take years to happen. And some people, because of their own internal immune system response, tend to output higher amounts of food proteins than others. So, we can work at trying to improve the gut. We can work at trying to decrease, yeast and, abnormal bacterial levels and try to bring some healing, over time to that. Can we absolutely 100% guarantee that all IgG reactions are going to go away? Unfortunately, we can't. But in many cases, they do at least diminish. Can glutamate levels be altered from overstimulation or sensory overload? Can glutamate levels be altered from stimulation or sensory overload? I don't know if you're asking the question if doing some things to try to decrease the sensory system and the overload that some people have will have an effect on glutamate or vice versa. What I can tell you, the best way I could answer this is that people who are very sensitive to glutamate tend to be those types of people that are very tendency to be overstimulated. And it has to do more with the receptor activity at the cell level than the glutamate level itself. Glutamate activates a certain type of receptor called NMDA. And there are certain individuals who have higher reactivity of their NMDA receptors than others. Alzheimer's disease, for example, there's research that shows that these NMDA receptors tend to be upregulated a bit. And so to the presence of the glutamate that's circulating in the brain at all times, they're just more responsive to it. And unfortunately, it can lead to a lot of cellular stress, oxidative reactions, and cell death that can occur in Alzheimer's. with the kids on the spectrum that I've seen, these NMDA receptors are very receptive to the presence of glutamate, and these are the kids that tend to be very impulsive, very, self-stimulatory, a lot of compulsive behavior, and, they tend to do well with things that tend to block those receptors, such as the medication called glutamate. So it's not, again, it's not 100% effect with everybody, but it tends to be very individualized. The next question is, have you referred anyone to have stool transplant, and have you witnessed success? I have inquired about it. Matter of fact, I've spoken with a couple leading authorities on fecal transplant here in the U.S. Their hands were tied, at least from a medical university standpoint, in doing fecal transplant therapy beyond anybody who didn't have a diagnosis of specific Clostridia difficile. So that's where most of the academic universities are. It's linked specifically to Clostridia difficile. I've not referred anybody out to try to do this at home on their own, although I do know there's some information out there about that. It's certainly, they definitely know that fecal transplant therapy for Clostridia difficile can be quite successful. And I think it holds a lot of potential promise for many of these kids who've just got ongoing Clostridia problems in general that, are beyond even just Clostridia difficile. I think it can work. I don't have anybody that's, ventured to try to do it on their own, but I think it holds a tremendous promise because getting rid of the Clostridia is incredibly difficult. The next question is, besides digestive enzymes and probiotics, what can I do to improve digestion and reduce problems like gas and reflux? Well, one of the next things to do if you haven't done it is do some assessment on your gut. That's where the organic acid test would come into play. Also looking at stool analysis, look for Helicobacter pylori infection, which is a bacterial infection that infects the stomach. That can knock out your ability to make hydrochloric acid, which affects food reactions. Look for parasitic infections. So you have to start doing assessment on potential pathogens in the gut that can be leading to those kinds of problems. And certainly looking at food reactions too through food sensitivity tests. The next question is, have you heard of any child on the spectrum become very acute to environmental noises when in school, and then when off of school become better with the noises? I don't know of a specific test for that. I think the one thing to look at is, and I have heard of this, I wouldn't say it's real common. So, the sound sensitivity issues. Yeah, I mean, one thing you could talk to is somebody like somebody who does auditory integration therapy, the AIT therapy, to try to bring a little bit more integration to the auditory system. They might have some input on something like that. Why would my 13-year-old grandson have high levels of uranium in his hair samples? It depends on where he lives. I've seen uranium in a couple places quite high. By the way, this is not the radioactive uranium that's leaking from a nuclear power plant. Southern California tends to be very high in natural uranium in their water supply. Years ago, there was a report in a local newspaper in Southern California that was about the EPA, the Environmental Protection Agency, was looking at uranium levels that they considered to be too high in the water supply of Southern California that was coming through some of the water treatment facilities. And what I've seen over the years is the vast majority of people who live in Southern California tend to have high levels of uranium. I've seen the same thing with individuals in Eastern Europe and high levels of uranium there. I know Dr. Shaw from Great Plains had a report, I think it was a child out of Kuwait, I think it was Kuwait, who had high levels of uranium. So there may be something going on there as well. But it's going to be regionalized to where you live specifically. All right, so the next question is, if the IgG test results come high in gliadin, wheat gluten, and wheat, can this be indicative of celiac disease? He was tested for celiac and the result was negative. The child is having ulcerative colitis. What it indicates is gluten intolerance, gliadin intolerance, but it does not specifically define celiac. In order to get celiac, you've got to have some other markers that you're going to be testing off of blood testing. So it's not definitive of celiac, but it is certainly highly suggestive of it. The bottom line is this: if you've got that much immune reactivity to gluten, the only way to resolve that situation is to avoid gluten. So whether it's celiac or just a real strong gluten intolerance, the treatment's the same. You know, the gluten needs to be avoided because it's having an adverse effect in the immune system. Now, there's always the off chance that maybe a celiac test was false negative or wasn't expansive enough. So my recommendation is just get rid of the gluten. And specifically if you've got a situation with ulcerative colitis going on. Let me go back and see if there's any questions I can answer that are not too long. And I'll keep searching here to see if anything new gets added. Well, there's a question here about, had radioiodine on thyroid, taking Synthroid, how does weather and food affect me? Meaning, how does food and weather affect thyroid function and reverse T3 with toxic hormone disruptors? This is a little bit of a difficult question to answer, but the couple things here with thyroid is that the thyroid is, you know, under control from the pituitary. The pituitary gets signals from something called the hypothalamus, which is the monitoring mechanism for what the overall level of thyroid hormones are like in the body. And so when the hypothalamus senses that thyroid levels are low, it's going to output chemicals to tell the pituitary, to tell the thyroid to make more thyroid hormone. The thyroid primarily releases something called T4. T4 is then converted through the liver into T3. And it's the T3 that has the physiological effect at the cell level. Now, there's a certain amount of T4 and T3 that's released as what's called total T4 and total T3, and there's a proportion of it that's called free T4 and free T3. The free fraction is the physiological active component of that. So what we're really looking at is the free T3 having the cellular effect. Now, there's always the potential that something may be blocking the free T3 from activating, you know, cell function, but you know, in the vast majority of cases, it's somebody just has an underproduction of the free T3. One of the things that will block the conversion of T4 to T3, or you could say block the conversion of free T4 to free T3, is chronic adrenal stress. So if the adrenals are stressed and the cortisol is involved, excess cortisol will block that conversion, and instead what the body produces is reverse T3. And reverse T3 is inert. It doesn't have a physiological function at the cell level, but it's a signal back to the hypothalamus because the hypothalamus has a hard time differentiating between reverse T3 and T3. And so when your reverse T3 goes up, it kind of shuts the whole thyroid production mechanism down. But the end result is it's coming because of adrenal problems. Now, there are certain hormone disruptors, in the environment, toxic chemicals, inflammation, etc. My recommendation is anybody who is undergoing thyroid therapy or thinks that the vast majority of their issues is due to thyroid, they also should be assessing their adrenal function. And that's where they would do something called the functional adrenal stress profile to look at cortisol levels and look at DHEA and see if those are off, because really both systems need to be worked at concurrently. Okay. Is taurine effective in lowering glutamate levels? Good question. I don't know. That's a great question, and that'd be something I'd have to look up. I can't say for sure if taurine is effective at lowering glutamate levels. Sorry about that. And let me see if there's any other questions here I may have overlooked. Kind of the same type of question came through about thyroid. There's a question here about that, an individual is in the process of addressing the thyroid hyperfunction and ruling out Hashimoto's. One of the things to consider about Hashimoto's is, again, it's an autoimmune disorder where the immune system is having a negative effect on thyroid function. We have seen in our practice a lot of people respond positively to removing gluten from their diet. Now, that sounds real simple or simplistic. It does work in some cases. What I would say is instead of just removing gluten, do the Food Igg test. Now, the nice thing about the Food Igg test through Great Plains is it is a finger prick test that can be done at home. So it's not a blood test you have to go to a lab to have done, because it may be that there are other foods that are overstressing the immune system other than just gluten. But that would certainly be top of the list for anybody who's dealing with Hashimoto's. Okay, so my son has been gluten intolerant in the past, but his GPL IgG only shows mild reactivity for all gluten-containing grains and GLAD and also green. He is also phenol salicylate intolerant and has been on the Feingold for years as well. Does it seem to be okay to let him eat gluten, or should I continue to keep him GF because of phenol issues, since gut health is obviously not optimal? This is another great question, and this really goes to the whole effect of what do the tests mean long term, and also what are the different kinds of tests for, let's say, if we just keep it to the discussion of gluten and casein intolerance. The IgG tests are specific for immune reactivity to a particular food. It's triggering an immune chemical, and that immune chemical has the potential to trigger inflammation in the body. And then that inflammation can have negative effects in the gut, in the bloodstream, in the brain. So we know that you can have a positive IgG test to wheat, to dairy, to soy, to a whole host of things. And people will often benefit when they take those foods away, including kids on the spectrum. Now, there's another component to the gluten and casein discussion, and that is the peptide reactions. And these peptides are small amino acid chains that are found within the gluten and casein that actually have a chemical configuration that's very similar to morphine, which is an opiate medication or opiate drug. And so the other aspect is that gluten and casein can have a drug-like effect on brain function and not necessarily have an adverse immune system reaction. So if you had a situation where, let's say, you removed gluten, or excuse me, you removed casein first, and you saw a big spark in language or a big spark in eye contact within the first week to 10 days. Well, that more than likely is a peptide drug-like effect, where that, you're having more of a chemical effect on the brain. That to me is more what you tend to see when kids have high peptides. Removing gluten and casein that has more of an influence on the immune system, over time you usually see that they get less sick, or if they had a rash, their skin improves, or their digestive system improves. So when you're talking about autism, or you're talking about, and the same can cross over to people with mental health disorders as well, sometimes they've got these peptide drug reactions and don't have a high reactivity to IgG, and then in other cases it's vice versa, and of course in some you have both. What happens is when, let's say you do an IgG test and you remove a food, well, eventually if you removed it 100%, the immune system is no longer being challenged. And those IgG reactions, which were once stimulated and created as a memory marker of exposure, eventually over time they'll start to ratchet down, they'll start to diminish. Now that can be different for different people depending on their body's ability to clear these things. So it may be, let's say for example, a year later you come back and you do an IgG test and all of a sudden the IgG markers are normal. Does that mean that your child is no longer intolerant to gluten or casein? Unfortunately, it doesn't. It just means that you removed it from their diet and the immune system or the body has had a chance to just clear out those old antibodies. Because you could reinitiate that food and get the same kind of reaction that would start all over again. So I can't say for sure that in your particular situation it's perfectly safe to eat. If it was celiac disease, then you absolutely know it's not, because that's more of an autoimmune problem. What I have found by, I don't like the word trial and error, but let's just use that for now. What I have found is that the longer the kids are off some of these foods, and the body has a chance to heal, the gut has a chance to heal a bit, there's not so much conflict going on within the immune system, that often over time they are tolerant of eating some of these foods in small amounts. Because they had a severe reaction when they were 3 doesn't necessarily mean that they're going to have a regressive reaction at the age of 8. But again, it's a dose-dependent issue. Some kids do well and they can have a little bit of gluten in milk and it doesn't affect them. But if they have too much, then it does, and that's going to be very individualized to the child. And I often say it's the pizza slice scenario. 1 piece of pizza, I'm good. 2 pieces of pizza, I'm a complete wreck. So I think in those particular circumstances, what you've got to do is go back in time and say, well, how quickly did my child get a response when I took them off of gluten and casein? Did things happen real quickly within a few days? If that's the case, then really what you're looking at is they had a really strong peptide drug-like reaction to that food. And that too can heal over time as well. So I think, to kind of answer your question here, I think it's something you have to discuss with your family, discuss with your doctor, and sometimes reintroducing a food to see if they're tolerant of it is the only way to know if you can broaden your diet a bit. What supplements do I use for adrenal support? Well, there's a lot of them. New Beginnings has some good products for adrenal support. They've got something called Adrenal Essence. It really depends on, honestly, what the deficits are. If we've got severe, issues with respects to cortisol deficits, things like licorice root can help bring that up. Adrenal support with respects to different herbal remedies, different vitamins to help support adrenal function. DHEA, pregnenolone are often used in adrenal programs as well, although I wouldn't use those in kids. So New Beginnings has some. Another company, Biomatrix. If you go to biomatrix1.com, they've got a whole line of adrenal products there. So, it's kind of individualized again as well. The next question is, what is the difference between IgG and IgG4? This is a great question. The IgG4 was used for many years by many labs as the sole antibody for food sensitivity reaction. What's been discovered over time is that actually the IgG4 of the 4 subgroups of IgG, 1, 2, 3, and 4, the IgG4 is actually a blocking antibody. It's actually blocking immune reactions. So when it's high to a particular food, that's a good thing. Unfortunately, there's been a lot of labs in the past that have used the IgG4 as a determining factor for an adverse food reaction. It only circulates at about 6% of all of the IgGs. So the more effective way of looking at IgG reactions is the total IgG, where you're looking at the other higher percentage antibodies, 1, 2, and 3. Do I have any experience using applied kinesiology through chiropractic to help eliminate food allergies? I don't personally do it. I have a colleague who's an incredible individual doing applied kinesiology. I do have some experience with people doing the nalbuphirapad allergy elimination technique, and that's been pretty helpful for some. So I do have some. I've seen some good success with that. So I don't do it myself, but I think it is a useful technique in somebody who's really skilled at it. Are there any tests to find out if my child who is on the spectrum is having anxiety issues? Well, there's not a specific, there's not a specific test that comes back and says, anxiety is present based on a saliva, urine, or blood marker. You can, you can get some testing that indicates that, serotonin levels may be low, which certainly could do it. You could get a test like an organic acid test again that shows you that VMA levels, which is called homovanillic acid, vanilmandylic acid, is high. That can be related to stress. So there's not a lab test per se, but what I can tell you from my experience, the longer I've been at this, is as kids are getting older, there's a lot of kids that are having a lot of anxiety. So I think just based on, behaviorally, if they're irritable, if they're emotional, if they're not, they're very resistant to change, if they are very controlling and ritualistic, if they're having a difficult time in school, if they're having a difficult time socially, in my experience, they've got anxiety. So I don't know if you need a test so much to define it as to just recognizing it. Have I found many kids with autism test positive for porphyria? Only a few, with respect to that porphyrin test that seem to relate, to the potential for heavy metal toxicity, but not levels in the thousands, where they would seem to have more of these, genetic disorders with respect to porphyria problems. Okay, well, why would a child continue sideways glancing after several years of taking cod liver oil? I guess the question is did the cod liver oil help with the sideways glancing initially? And if it did, and then the sideways glancing is coming back, there may be some other factors where you have to either increase the dose or look for a different type of vitamin A to have that effect, or there's always the potential of increasing toxicity in the body as well, that could be affecting those G protein receptors in the eyes. So if he's continuing to have sideways glancing after several years of taking cod liver oil, to me, the cod liver oil is not the answer. and there's some other kind of, visual sensory imbalance going on. Let's see. Are there any tests to diagnose systemic lymphatic congestion issues? And what are your thoughts regarding standard treatments? Yeah, unfortunately, this is not something I know a lot about. So I don't know what Gaucher therapy is. So I'm sorry, I can't help you on that one. What do you do for syndrome for affective disorder? D-test is over 100. Light therapy is in place 1 hour daily during wintertime, early in the morning, and dose is not getting better. Any supplements that can be used? I've not personally seen a lot of this myself, even though I live in the Northwest now. I'm more on the sunny side of Oregon. So I think what I would start with this is that I would look at adrenal hormones for one. I would look at cortisol levels. I'd look at DHE levels. So I would do a salivary adrenal test. If you go to Lab Test Plus, there is a functional adrenal stress profile that I would look at with respect to that. I don't know. Actually, you know what I would do? I would do the 2. It's called the Functional Adrenal Stress Profile Plus 5. It looks at melatonin levels. And let's see what the melatonin is doing. You may need to do a further assessment on melatonin. I'm trying to think here. This is one I'd have to think about. I can't right off the top of my head kind of go through all this. I just haven't had many patients like this. Okay. Are there any audiologists that you know of that can test a child on the spectrum that is 8 years old but is cogitally at 6 years old? Well, I think it depends on where you live. I think the best thing to do on that is I would email my office at info@mysunrisecenter.com. And a good place to start is somebody who's at least has some training in auditory integration training. And you can look up, I forget the name of the website, just type in auditory integration training or AIT therapy. And you'll probably be able to find there's a network of individuals involved in that. And you can look around. I believe you can look in different states and in different countries. I don't remember the website right now, so if you email my office at info@mysunrisecenter.com, I can help you out that way. Why do many kids with autism have low muscle tone? Well, some of it has to do with the methylation system. One of the things that the methylation system is involved in is it helps with creatine formation, which is involved in muscle metabolism. I think it also has to do with there's dysfunctions internally in the brain. The cerebellum, for example, is often affected, and there's different brain regions in the brain that are often affected in autism that can affect muscle tone as well. So it simply can't be ruled away just by doing creatine supplementation or methylation support. There is some effects intrinsically in the brain that have led to that kind of issue. And let me see if I can answer this one here above. According to Dr. Derek McFaby, the acylcarnitine could help transport fatty acids in the cell to counterbalance effects of propanoic acid, which interferes with mitochondrial metabolism and a byproduct of bacterial fermentation. I've used L-carnitine, and I've used acetyl L-carnitine with good effects with kids who tend to show up with fatty acid metabolism problems. So, and by the way, the organic acid test, from Great Plains actually has a section on there that often comes back high when you see an elevation of bacteria and yeast. I see that section often high when Clostridia is high or just Candida is high. So clearly the organisms have an effect, or the toxins of those organisms have an effect on cellular metabolism with respect to fatty acid transportation. So I wouldn't say that there has been huge home runs across the board in just using L-carnitine, but it doesn't hurt, to implement it as part of a supplement regimen overall when using fatty acid supplementation. It seems to make sense to do it. I heard Dr. Shaw lecturing a number of months ago, and there was a young boy who was doing cod liver oil. And matter of fact, this actually leads back to the person who asked the question before about side glancing. They were using cod liver oil, I forget how much, but they ended up having some visual issues from it. And I don't remember if it was side glancing or not, but it was improved by implementing L-carnitine supplementation. So the person who asked the question here about the continued use of cod liver oil and getting side glancing, one thing to consider is implementing L-carnitine. I usually will dose it between 500 to 1,000 milligrams a day. Usually, conservative, about 500 milligrams a day seems to work well for most kids. So what may be happening in that situation is that they're not transporting the fat into the cells effectively, and for whatever reason, it's just affecting the eyes in that particular way. It says, what would you give a leaky gut patient who has issues taking fish oil or even a possible allergy to give them similar benefits? Are you saying a possible allergy to fish? I mean, there's. I'm not sure if you're saying give them. Yeah, I'm not sure about that. Let me see. What could be causing hypertonic muscles accompanied by poor balance and jerky eye movements? Well, one of the things that could be is a fatty acid metabolism problem. And you can look at, fatty acid, the fatty acid analysis that Great Plains has. That certainly could be an issue. Certainly potential amino acid imbalances might be causing that. I think what I would do is I'd start going through my checklist of tests. In this particular one, I would do some blood testing. I would look at total cholesterol levels. I'd look at a fatty acid analysis. I'd look at an amino acid analysis. I'd also do an organic acid test to see what's happening there with respect to yeast and Clostridia problems. The hypertonic muscles is an interesting phenomena. We often see people with MS who get a lot of cramping and spasming. And there's some evidence in MS that it actually is an abnormal histamine metabolism problem, that they're not making the right type of histamine. They're tending to drive more histamine 1, which is causing a lot of the allergy and inflammation, and not making enough histamine 2. And so there's an interesting therapy called Procarin. It's spelled Prokarin, You just go to procarin.com, and it actually has a very, very beneficial effect for many people with MS. So that's something to consider there. Somebody asked the question, was that carnosine or carnitine? And it's the carnitine with a T. So L-carnitine helps with the transportation and metabolism of fat at the cell level. Let's see, we're going to go for about another 6-7 minutes here, and then we'll kind of wrap it up for the night. Any final questions? I'm looking back to see if there's anything I can answer that maybe I had to skip over. I think I've answered a lot as best I could. Well, with that, everybody, I think everybody, it looks like we may have reached our max here. Again, if you've got, if you're a parent of a child on the spectrum, feel free to join me through the Autism Action Plan site. You can post me into the parent forum. You can also post me privately there as well. If you're a practitioner, you're certainly welcome to be part of that site too, and you can post me right through the parent forum as well. And then if you're looking for, additional testing, if you're wanting access to integrative medicine testing, check out the labtestplus.com website. There's actually a section on that site for videos. We recorded, I forget how many we have. It's like 25, 30 videos on all of the different tests that I briefly discuss, what the tests are for and how they're useful. So you can access that information there as well. And then, of course, if you're an individual who has some questions about testing, just go to the labtestplus.com site, go to which test section, and you can submit your question there to say, hey, doc, this is going on, that's going on, what lab might you recommend? And we can try to give you some feedback that way. So I appreciate everybody coming on. There's some great questions tonight, by the way. It really helped to kind of expand the discussion. So anyway, everybody have a great night, and we'll see you back in July, okay? Take care.